Welcome back to New Day. Weight loss is a complex and very personal issue, and it's one that many struggle to find the right solution to. The weight loss services at Providence Swedish offer both surgical and non-surgical options. Dr. Anirban Gupta joins me now to talk about those options. What are some of the common questions you hear from patients that are seeking both surgical and non-surgical, or do they come in and say, what should I do?
That's a great question. So, generally patients are wondering, what are the indications? Do they qualify? What is their risk of undergoing either type of therapy? And then, of course, timelines, insurance requirements. So they generally ask personal questions about themselves, and then, of course, what does the journey look like?
So what do you talk with patients about when they're coming in to do this? What do you have them consider?
So the first thing is I need to meet them where they're at. Like, what is their goal? Why are they here today? What are they hoping to accomplish in terms of their health outcomes, their weight loss outcomes? And then we try to match up their goals with the best therapy, be it surgical or medical, and then the different types of surgical options.
It is really important that you do both. So just give me kind of an overview of what kind of services that Swedish offers when it comes to this.
So Swedish offers a very integrated multidisciplinary approach. We have both medical and surgical weight loss, which includes a comprehensive team of dietitians, psychologists, nurses, medical assistants, navigators, medical weight loss physicians, and then of course metabolic and bariatric surgeons.
Wow.
So we all come together, we work together to figure out what's the best therapy for our patients and then move them in that direction. With their choices and preferences in mind.
It seems really comprehensive because there is so much that has to do with the mind, the psyche, the body. For those who might not want to consider surgery, if they're not ready for that yet, kind of walk us through that journey. What does it look like to do the medical route?
Right. So they'll meet with one of our medical weight loss providers, and then they come up with a personalized plan in terms of, again, matching their goals with the best treatment, which could include diet, exercise, pharmacotherapy or medications. There are a variety of fantastic new medications which can help patients achieve significant weight loss. And then they'll tailor a plan with longitudinal follow-up based on that patient's goals and needs.
It seems just really reassuring, I guess, because it seems at times when you are trying to lose the weight that it's impossible and that there's nothing that can help you and you've tried everything. So coming to a doctor sometimes is really the only option because, weight management, it's complex, it's personal. How does a patient decide what's right for them?
So I think it comes down to shared decision making. It comes down to us as providers and caregivers giving our patients the best information and then figuring out what are their goals, what are their preferences, and matching the two. And so it comes down to education, informing and empowering our patients. And so that's what we're all about.
Does it start at the level of your GP? I know that, even for me, they look at my BMI and they're like, all right, Adrisi, you are technically overweight. How important is it to start these conversations with your GP, and then how do you get to Swedish and in the weight loss management there?
Right, so I think the partnership starts in the community. It starts with your primary care physician and your primary care team. But it doesn't end there, that's the first point. And then it results in a referral to our program. Patients can also self-refer. We have self-referrals as well. But it's either a referral from primary care or a self-referral, and then we take it from there.
It's so key that that you do have that psychology component, that you do have the medical component. If somebody wanted to find out more about what you do, where do they go, and what makes your program so unique?
So what I would say is metabolic and bariatric surgery is the most durable, safe, and effective therapy for weight loss, for diabetes remission, cancer prevention, improvement in quality in life, and so on and so forth. And Swedish Weight Loss Services is the best place to get that care. So I would welcome our patients to reach out to us and their primary care physicians to reach out to us as well, and we'd be happy to take care of them.
Just having these talks with our doctors about our health it's so important, and it is a difficult issue. I think it's very personal, so I'm grateful that you came on to talk about this today and be so open with everything that's happening over at Swedish. And of course, whether you choose surgery or non-surgical options, Swedish Weight Loss Services at both Issaquah and the First Hill campus. They can help you. Just go to swedish.org/weight-loss to find out more. All right, well, we pride ourselves on a staff that makes good use of its time. So that's why we sent New Day's Derek over to Eastern Washington in search of the state's best tamales. Stay here to see what he found.
This portion of New Day Northwest is sponsored by Providence Swedish.